Good afternoon, everybody. I am Dr. Arijit Ghosh, the Cath Lab in charge, Manipal Hospital Broadway. So today we are going to talk about valve replacements. We all know that usually valve replacements are done through surgical maneuvers, and surgery, that too a very extensive surgery, is required to replace the valves. We in our heart have four valves, namely the mitral valve, the aortic valve, the pulmonary valve, and the tricuspid valve. All of the valves can be surgically corrected, but in common day-to-day practice, we see that the aortic valve and the mitral valves are more commonly surgically replaced. So these are the two valves which are very important, because the mitral valve is important because it draws blood into the heart, and the aortic valve is important because it helps in pumping out blood throughout the whole of our body. So anything going wrong with these two valves requires immediate attention. So in current day practice, there are surgical replacement of the valves which are predominantly done by mechanical valves or biological valves. By mechanical valves, we mean that the leaflets of these valves are made of some metals. And by biological valves, we mean that the valves are usually made out of biological materials, namely the pericardium taken from cows, the pericardium taken from sheep. These are the things that are used to make this valve. In the elderly, the general rule is that in the elderly people, we usually go with a biological valve, and in the younger people, we go with a mechanical valve. The basic premise is that mechanical valves are long lasting, but at the same time there is a downside that these group of patients require a long term blood thinners, that is known as anticoagulation, and they require to keep their bloods very thin, and that is usually measured by a parameter known as INR. But when we use a biological valve, it does not require any long term anticoagulation, and the patients can be put on anticoagulation for the next 3 months, and then anticoagulation can be withdrawn. So a patient who is having a very high risk of bleeding can be managed by a biological valve. But at times we are quite afraid about open heart surgeries that are very extensive. It takes a long time. So surgeries are not offered to people who are having very high risk of surgery. The patients who are quite elderly, they have a very high risk of getting into trouble while and after the surgery. So they are often denied this benefit of surgery. But one thing is to be borne in mind, that whenever it is a problem of the valves, it is a mechanical problem. So the valve got to be replaced, and there is no place for medical therapy for these problems. So a valve replacement is a must. So nowadays, the people who are very high risk for surgery, they can be offered some alternative form of treatment, especially when it comes to the question of aortic valve diseases. The aortic valve diseases are usually the diseases that we see in the elderly population, and some of these patients are a very high risk for surgery. So they are often denied surgery, and they live a very pathetic life, and their lifespan is truncated. So what we can do is that if we have some alternative way to bypass surgery and finish off this valve replacement by just a minimally invasive procedure, that is a transcatheter valve replacement for aortic valve, which is commonly known as TAVI. As we all are quite, I think we are all becoming well versant with this TAVI procedures, and this is done in almost all hospitals in our vicinity in Kolkata, and my center also has the facility to perform a TAVI procedure. So this is something very encouraging for those group of people who are at very high risk of aortic valve replacement. So TAVI is the most happening thing right now. By doing a TAVI, we can offer the patient a valve replacement without cutting open the chest, and in most of the cases, the patients are discharged by day 2 or day 3 from the CCU. And long-term anticoagulation is also not required, so the chances of bleeding after the procedure is quite low. A TAVI is definitely a costly procedure, but in the patients who are suffering from aortic valve stenosis, severe aortic valve stenosis. This is the only answer to those patients who are at very high risk of surgery. But still, I should say that if surgery can be performed in a patient, surgery still remains the first choice, especially in the patients who are less than 75 years. But the patients who are more than 75 years or more than 80 years, the natural choice for aortic valve replacement is definitely TAVI at this day and age. So with this, I end this talk, and this is something that again should be, I reiterate the same thing, that for a valve disease, there is no place for medicines. Valve replacement is the only answer, whether it is done by the surgical route or by a transcutaneous route that is known as TAVI, is the only answer for the patient, and that will keep the patient healthy, and it will increase the longevity of the patient. Thank you.